My name is Sharon Lynn Kagan. I am a professor of early childhood and family policy at Teachers College, Columbia University, where I also co-direct the National Center for Children and Families, and I'm a professor adjunct at Yale. Well, it depends on if you're talking about engaging families within formal structures like schools or child care facilities, or if you were talking about engaging families in the educative process for their own children, which could take place in homes and libraries all over the entire community. So there are different strategies. I think, however, they both begin with making sure that parents have a very fundamental knowledge of child development and why the early years really matter, and why it is important to be engaged verbally with your children, to be engaged in all aspects of their development. Well, there are communities who have taken on precisely this task, and they do so in a very comprehensive way. They develop a community-wide plan. So it will range from everything of posters on buses to using libraries and other public facilities as venues for lots of conversations. It uses all sorts of different funding streams and different mechanisms to make sure that families become aware of the importance of the early years. Hospitals, for example, take on immediately postnatal information sessions. Home visiting becomes an important part of a community's repertoire of services, so that parents with very young children are visited in their homes. And this is across incomes, across ethnicities, so that parenting and the importance of parenting becomes sort of a normative vibration in all of society. So it's not about, the point is, it's not really about just doing one thing or having one agency. It's about a total community commitment to recognizing the value and the importance of parents' role in the educational life of their children. We know from tons and tons of research studies done over many years with very high quality scientific standards that only when programs are of high quality do they reap the benefits that are associated with early childhood, and that having children in low quality or mediocre quality programs does not reap any benefit whatsoever. So that the goal here is to make sure that all early childhood programs, irrespective of whether they're in homes, family child care, whether they're in centers, whether they're in schools, it doesn't matter where, but that they are all of supremely high quality. A lot of the benefits depend on what the children come in with. So that, for example, for children who come from families that may not have all the resources the parents would like to use for their children, those children benefit dramatically, and they benefit in terms of cognitive gains, in terms of social gains, and indeed all the data indicate that these gains are sustained virtually over a lifetime. Children who have been involved in high-quality programs are less dependent on welfare, referred less for all kinds of adjunctive services, are incarcerated less, so the benefits are really quite durable over time. For middle-income children and for upper-income children, there are tremendous benefits as well, because they gain in socialization. Families are having smaller and smaller numbers of children every year, and so the early childhood programs become a venue for this sort of socialization, and they too reap incredible benefits. It means making sure that parents have ease of understanding the repertoire of services that are available in the community, the things that they can access. It means having a single point of referral. That's on the consumer side. On the supply side, on the governmental side, it means making sure that we eliminate all redundancies of programs, that we achieve all kinds of cost efficiencies by not having redundant services, that we eliminate bureaucratic red tape, and that we blend funds so that we accentuate the smoothness of service delivery. In early childhood, it means developing a superb governance system so that these programs really have a place to turn to. It means developing a financing mechanism that is durable over time. It means making sure that everybody who works in these centers is very, very well trained. There are, like our bodies, we have different subsystems. We have a respiratory system, a circulatory system. An early childhood system has to have financing mechanisms and approaches to govern and approaches to quality monitoring and quality control. I believe that we are making very strong steps, and I am very appreciative of the efforts that the governor has made. From my experience working with all 50 states and hundreds of countries abroad, without a durable governance structure, someone to oversee the coordination and oversee the linkages, who has statutory authority, who has accountability, and who has funding to make this happen, we are not able to as easily achieve successful systems of early education and family support. So to me, governance is the key. Indeed, it is interesting that a strong majority of the states who won the recent federal Race to the Top Early Learning Challenge Fund all had very strong governance mechanisms. Connecticut does not. And so I do think that that's a really potent area for us to work. So if there were one thing I would do that. Second, I would make sure that we have a durable financing system. And third, I would make sure that the people who work with young children are adequately trained and appropriately compensated.